certainly isolation. We're still feeling that. There are people we don't feel comfortable hugging still in certain areas of the country. Loneliness, grief. People have been having to grieve during this pandemic, and it's been made very, very difficult and stressful, which is why we will also talk about stress, anxiety, and often what comes with both of those is depression. There is help out there. And the more we talk about it, the better whenever it comes to mental health. And I don't think a lot of people in this country really talk about it enough. So joining us now is Erica Cerquetti. She is with Gilchrist Integrative and Palliative Medicine. And thank you so much for being with us, Erica. She's getting mic'd up right now from our remote studio, but she deals with a lot of patients and families, but certainly a lot of people who are elderly and dealing with Alzheimer's or medical conditions. But what comes with that oftentimes is some mental health issues that can be very, very real and debilitating and have been spiking or heightened during this period of COVID-19. Erica, thank you so much for being with us.
Thank you for having me.
So let's just start off with talking about what you do on a general basis.
Sure. So I actually work geriatrics and integrative and palliative medicine. So when I work geriatrics, I typically work in a subacute rehab setting here at GBMC. And then for integrative and palliative medicine, I'm doing the outpatient consults for that, primarily with our oncology patients.
Okay, on a broad scale, and it can be very anecdotal, what are you seeing during the pandemic specifically? That's different.
So this has been very, very hard for the entire community and everyone in the population, but especially the elderly population is affected. This is a population where sometimes your functioning isn't great to begin with, and you're trying to work with that. You're trying to get therapy, you're trying to get to the doctor's appointments on time, and perhaps you may not be as wired up as some of us, young folk with all the technology. So there's many challenges to look at here.
Yes, I actually have an 82-year-old mother who's only been out of her house one time in the last 3 months. And for a while we were talking to her through a window, and we have now gone in the house with our face masks.
With your mask, yeah.
And it's been very difficult for her. And I think it has affected her mind because all she's getting is what she's seeing on television, and she can make some phone calls. But we ticked down that whole list: the isolation, the grieving of not just maybe losing someone you love, which is the most poignant, I think, form of grief, but also grieving a life we knew 3 months ago.
Exactly. It's sort of it's a global version of grief. So even if you're already grieving something else or the loss of a family member or friend, you're then also going through the stages of grief with the current pandemic situation at the same time.
So here's the million-dollar question. What can we do? We're so limited right now.
Yes, a lot of people feel very limited right now, but there are ways that we can still provide care, and there's ways that we can help ourselves through this. And, just blanketly saying self-care itself doesn't mean too much alone, but actually giving the detail to what that entails and what people are capable of. I usually say this during interviews. I'm a professional musician outside of here and performer. And just even amidst my musician friends, this has hit the community so hard. The one thing we're good at, we can't do live,
Right.
So that's also affecting people, the arts, the everything. And so one of the best ways to stay involved is through your family and friends. We have to, at this point, use technology for everything it's worth, even if it involves getting outside people, on the line, case managers, social workers, to help us communicate with our loved ones, especially in settings where visitors aren't allowed right now.
Yeah, it's amazing what one short conversation with somebody else can do for your day.
Exactly. And I believe Dr. Thompson was even talking about, the effects of social isolation and lower social engagement on cognitive impairment, and it can amplify it.
Okay, so we have some very real coping strategies that we're going to put on the screen for everyone to see. And I know people say, oh, okay, I've seen those before, but let's just take a moment to look at them with a fresh set of eyes and really, really consider them because they've proven to help. So I think you can see them as well, can you not, Erica?
Yeah, I can see them.
So why don't you talk about each one of those?
Sure. So movement, I don't want people to look at that and think I'm asking you to go to the gym and because you can't anyway. But also I'm not asking people to get buff. What I'm asking them to do is whatever movement they can do, they should do. Let's avoid prolonged sitting. If you can move around well, let's try to move around at least every 1 to 2 hours, just to make sure we're still moving, that the blood flow is still moving with us.
Okay, so
helps. Yeah.
Elderly population, if you can get out of bed, get out of bed. If you can stand, even if you're standing and sitting, right, from a chair, something every couple of hours.
Changing position.
Okay.
Yeah. And also taking short walks, even if it's around the home, even if it's right outside around the house, it's better than not. Because when we do that, again, we are embarking in activity that's important to keep our neurons going.
Do you think that in order to get this movement that we should somehow be diligent in keeping structure in our day?
Yes, I'm a big believer in routine building, just to keep a sense of our normalcy into our day. Since we're constantly, humans aren't used to adjusting this fast to things changing this fast. And also I know how ironic this sounds and people keep watching. But after this, you might want to turn off the news. So I want people to stay informed, maybe for no more than 30 minutes a day, because past that, it can breed and upcycle anxiety and our fears and even our empathy. We can get a care fatigue from it. And so we have to be careful. We have to both stay informed, but limit our screen time and limit our time with news even blasting in the background.
Oh no, you are preaching to the choir here. I worked in news for a long time and you have to recognize yourself when it's getting to be too much. And then you just have to turn it off. And it's okay to turn it off. It's okay. You will get the information you need. Number 2 on here, I think people tend to eye roll sometimes when you mention this, but it has been proven, and I keep reading more and more about it, it's just been proven over and over again to help in so many ways. Breathing exercises,
so let me go into that a little. So breathing exercises is basically one of the only ways we can technically feel like we have control over our heart and lungs. If you're breathing and slowing down, that actually helps with feelings of anxiety, of panic, of feeling overwhelmed or alone. It helps in inner calm come into being. And one of the best ways to do it, there are, of course, videos, CDs out there that teach mechanisms for this. In our integrative and palliative consults, we have a mind-body specialist that is doing video visits with us now to further go over those techniques. And then there's apps like Headspace and Calm that teach very well in a very sequential way to build up to your best self through breathing and meditation. And we must also remember yoga and any of those movement exercises that concentrate on breathing. It's just meditation with movement,
Yeah. And it improves your lung and your heart function. And I'm just going to, because we have the time, what is your favorite way to do a meditate? I mean, I've heard of square breathing where you breathe in 4, hold 4, release 4, something like that. So what would you do?
So square breathing is an excellent way to start. I've also taught vocals, so I'm all for the diaphragmatic breathing where you're using the base here to get in the air to really bring on a calm. So I've taught a lot of those. And then there's just breathing naturally, but staying in the moment and being present, in terms of mindfulness, that counts too. It doesn't necessarily need to be a certain way of breathing to help you calm down or help you manage the symptoms of social isolation.
But if I'm sitting at home and I'm watching you right now and I'm like, well, do I breathe through my nose? Do I breathe through my mouth? Do I breathe in through my nose? Do I breathe out through my mouth? Give me this one exercise. Go ahead, just do it for us.
Sure. So typical breathing 101. It'd be through the nose, out through the mouth. So You can close your eyes if you feel comfortable. You don't have to. The reason I love Headspace so much is that the narrator, either a male or female voice, they both go into it sequentially. And so I think it's really important to remind us, because you might not remember at the time exactly how to do it, but I don't want people shying away just because of that. So at very baseline 101, in through the nose and out through the mouth.
All right.
You can even incorporate arm movement with it as well.
It makes a difference. It's a good thing.
That counts as movement.
Okay, good. So we've clicked off 2 there and 1. Counseling. This is something that I know you guys provide. Is that right?
Yes, we provide counseling through our integrative consults. In addition, teleconsults are everywhere now in terms of like case managers, social workers. I'm thinking of people that are in facilities. That could be a potential for getting them help, even at a facility or at an assisted living, potentially with some help from the staff.
Do you find people are hesitant to get help? They kind of, for many reasons, they may say, well, I should just buck up and take care of this myself. I don't even have COVID. Some people have it worse than I have it. I just need to, get through this. I know that some of the stigma is decreasing, but it's still there when it comes to mental health, and oftentimes people won't reach out. So it's a twofold question. 1, just answering that, and 2, if we have someone we think needs help, but they won't do it, how do we go about getting them to get it?
Sure. So usually I'll answer the second part first. Right. Usually when I see a patient who needs psychiatric care or help or counseling or even just grief counseling, depending on what they need, I will usually refer out to telecounseling and telemedicine in addition to following up with us from integrative medicine, since we also do pain management and symptom management also. So I will specifically pick out what is best for them based on the services around here. So to answer the first part of that question, where there's a stigma, people are just trying to get through it. Yeah, that was me like 4 months ago, where I was like, it'll end soon, probably. So I think humans in general, all of us, have issues dealing with uncertainty. That is a natural source of stress for us. And the fact that it's an illness, we're worried about, and there's still everything else going on. So we still could be grieving other things. We can still have other diseases and chronic conditions that need help. And that in itself just piles on the stress. So it's very important to talk to somebody. And the main reason that is to get over the stigma of that is that truly the mind is the body is the mind. It affects the entire body. So if you already have chronic conditions, having anxiety and depression aren't going to help on top of that. It's actually going to make it a lot worse. So it's part of your medicine.
I'm curious, as much as you know about the mind-body connection, about mental health, about living your best life, about geriatrics, did you find yourself being caught off guard with how this pandemic affected you even?
Yes, because I had to be pretty flexible. I had to learn all the virtual visit stuff. I still have to come to the hospital and work on the subacute rehab. There's a lot of different guidelines. It changes every day. So it's been a lot of, I do a lot of jazz improvisation in my musical life. So I'm kind of used to things being changed up a lot, but even this was challenging for me. And that's how I know it is very challenging for almost everyone, if not everyone right now.
So what are you seeing, not specifically, but in general, in your patients who you were maybe talking to or working with before COVID-19 and now through it, and even new people who are coming in, it's now changed it up a little bit?
So I think the biggest thing that's changed is if we looked at symptoms, and I always say this, if they were on a mixer, usually you have your guitar track, your piano track, your drum track, and then master volume. Let's assume you have a bunch of symptoms, and then your anxiety is now through the roof because of everything going on. That's what I'm seeing the most of now. I'm seeing an amplified response, amplified issues even with chronic disease processes. And so we have to even try harder for appropriate symptom management and really getting to the root cause and helping people really get to the best of their self-care regimens and routines to optimize the regimen the best that we can.
Do you get the sense too that a lot of people are going to have to, as they're working through their anxiety, practice a form of acceptance as to what could be the new normal?
Right. In meditation, it's the practice of noting, where, for instance, you have chronic pain. And while you're meditating, you note that you have chronic pain, but that's not all you are. So there's a different way of looking at it. It's like recognizing, yes, this is where we are right now. And that's part of being present. But if we fixate on the future too much, which is highly uncertain, that builds up a lot of stress that can really take down our physical and mental health.
For people who might be watching and thinking, gosh, I've been having maybe some physical symptoms lately. I don't know that I'm stressed, but isn't it possible to be stressed and be anxious and not realize you are?
Definitely. There's a very somatic feel to that kind of anxiety and even depression where your pain can be amplified. You can be sore all over and not know why. Now, I would like to add an aside here that for symptoms that are new, acute, that, people know themselves. But I'm saying if there's new symptoms, just like Dr. Thompson said, there is a time and place to present to the ER. There's a time and a place to definitely have a conversation with your primary care about those feelings first and foremost. But, if this is over time and it's evolving and, you've already had tests to rule out the acute diagnoses that they're not, it's time to examine the full mind body to see if there's anything from this side that we can do, that we can change our behavior, change our regimen and routines to make things better.
What kinds of symptoms should we be looking for, not only in ourselves or in ourselves, but in our loved ones, particularly if we're older?
So typically, I would say when we get more forgetful, that could also be from and could be masked by an increase in anxiety and depression. So that's a big thing, is that this also affects cognitive impairment. So if we're starting to, especially through times of stress, forget a lot of things, it's time for a doctor appointment with your PCP, and then moving on from there to specialists as necessary, just to make sure that we're seeing the condition for what it is and we're treating all the right symptoms that may be on top of it.
I'm wondering, Erica, if this isolation has been all bad. Are you finding people who are having maybe a sense of relief at the things that they don't have to do now?
Yes, there
or maybe
are
that's
a few
an
who
age.
are just fine.
Right.
And also people that have hobbies, they're doing pretty good, even though it takes a lot of change. People that have a spark for creativity, this is a good time to utilize that. If you're creative, this is a great time to either develop a hobby that you love doing more, or find a new one and try a new one, make new brain connections. This is an excellent time for that.
Yeah, and if you read, I bet you've been through a number of books too. Dr. Thompson, yeah. Erica talked about some of the challenges with telehealth and not being able to be with the physical person and do a physical exam. I'm sure a lot of what you do is talk with your patients.
Yeah.
So
sure.
Are you running into stumbling blocks too with the telehealth?
Sure. I would say that from the basic medical exam that we are used to doing, that's been changed a bit. But I have to say that there's a lot of observations that can be made through video. For example, I see people walking through their house with their phone while talking to me, so I know they can walk. So there's simple observational strategies that we can use, at least in integrative and palliative medicine and many other forms of telemedicine, just to get through some of that. You're not going to be able to listen to the heart. You're not going to be able to hear lung sounds close up with a stethoscope. But there are other observations that can be made that basically will tell you how healthy your patient is when you see them on telemedicine.
Technology has been a gift, I think, for a lot of people during this time especially, and also frustrating for others who aren't as adept at using it. But you made a nice presentation here, a nice slide of some of the ways that we can actually engage more through technology. And I think you were very clear on, this isn't about watching the news all day or watching Twitter all day long. This is very productive ways of engaging through technology. Can we talk about some of these?
Sure. At the very start, like even before getting into any smartphones, even just making phone calls to family members or emails to family members, even that helps in getting you more socially engaged during a time of isolation and pandemic. So that's like the starter. That's where you start. And then after that, think of all the Thanksgiving dinners with younger family members who just want to get you set up with tech. This is the time for that. This is definitely the time to involve the family members that are tech gung-ho all the way. And they can get you set up. And even over the phone, over Skype, even over remote access with a computer even. And furthermore, social work, case managers. I've been tech support for my integrative patients. So I'm happy to help, and most people are happy to help with that.
You know, people have been criticized over the last many years for, doing words with friends or doing these games, big waste of time, all this. But now you're saying, no, those can really be great for your brain.
Because think about it this way. Are you watching a news ticker all day and hearing it and your heart rate's going up? Or are you doing words with friends? That's sort of the take-home message here, is that if you're actively doing something that's constructive, like thinking of words, Sudoku, which is more mathematical for our people who like numbers and number games. If you're doing puzzles, there's even virtual puzzles that you can do with friends online, which is awesome. So you don't need to be in the same room, and you can set up a puzzle together.
I love this idea of the virtual museum tours.
And it's so important right now because there are a lot of parts of museums, exhibits that are shutting down. They can barely stay open. So anything that we can do to support these structures through this is not only important in society for everyone, but it's super important to stay connected to the arts and the historical districts through this time. And it's quite phenomenal. I think even some zoos and aquariums are doing virtual tours right now. So there's a lot of beautiful stuff to look at. Yeah.
Yes, people are really trying to figure out how to get their message out, whatever it may be, online, including musicians. I've seen some great performances, really amazing performances, as I'm sure you have too.
Yeah.
One thing that I don't know,
there's really a lot of room for that.
I don't know if we mentioned it. I don't know if everyone is capable of doing it, but if you are, just sort of getting outside can be very good for your mind and soul.
Yeah, and even if you're able to garden and do that as well, do what feels right. If you have a porch or a back porch, a hammock, anything like that, any time that you can spend outside, at peace with yourself even is so healing and so important to just get out of your house. Not go places necessarily, but even, the porch is a different room and it's outside. Yeah. That counts. And I want to say how important that is.
Erica, it must have been so upsetting for you, because geriatrics is one of your specialties, to see how the elderly population was affected by this pandemic.
Yes, it has truly been a tragedy in that regard. And we have to do everything possible to protect our elderly right now.
If we have concerns about, and I'm just going to take this from my perspective, if we have concerns about an elderly relative, or if there's someone who's older who wants to be proactive on their own behalf, how would they get in touch with you or other members of your staff? What would be the first step if they're watching this and they say, wow, I think it's time for me to get some help on some level?
Sure. So the best way would be going through our office number, which I believe we have on a card. It's 443-849-6255.
And they just call and they just broadly say, hi, I think I may have depression. I'm 75 years old and I've been in the house for 3 months and I just can't take it anymore. I mean, they just kind of pour out their soul, or how do you start?
No. So I think the best thing is to decide what kind of services you need first. And then usually, at least for an integrative consult, we usually do need people going through their primary doctor or their oncologist, and then they make a referral. So there is a referral process involved with the integrative medicine. However, I work for Gilchrist. We offer a whole bunch of different services for every aspect of life, including geriatrics, adult medicine, all the way through end-of-life care and grief counseling as well. So calling up Gilchrist is a good idea. We can get you to the right department and the right services that you need.
All right, Erica Cerquetti, thank you so much for being with us. We'll continue to breathe in, breathe out, and hopefully we'll all make our way through COVID-19 and stay healthy. Thank you for joining us on Greater Living today.
Thank you for having me.
Be well. And to all of you, be well too. And thank you for joining us. And there's a lot of resources out there. I think that the takeaway for everyone is if you feel you need help in any way, go get it. It's there for you. Have a great day.